Doctor, I'm sure you've heard already about the President's decision not to declare MGCQ yet, which was originally being pushed very, very strongly by the economic managers of the country. So the President says firmly, wag muna. Kayo po, what is your group's position on this? Are you breathing a sigh of relief?
Yeah. In
Oh, you are?
real, yeah, yes. In reality, we are all for it. We are very supportive of what the president's decision had been, no, as far as the community quarantine. Kasi if we do shift from GCQ to MGCQ, that will mean shifting the responsibility of protecting our the Filipinos on ourselves na rin, ano? And the main question is, are we equipped enough or empowered enough to do it? So I don't think that we are actually ready, kasi marami sa ating mga Pilipino, mga kababayan, kung mapansinin na natin at this point in time, they are not using their face mask and face shield, and they are not maintaining physical distancing. So yun yung minimum health protocols na dapat na na sinusunod natin, and many of us are not doing it anymore. And that's why we see, di ba, increases in the number of COVID-19 cases. Sa ngayon, we're more than 2,000 cases, no, in a day for today. So that is higher than last week. So I think we need to improve our self-protection, and we also have to make sure na yung transportation natin para sa mga tao will also be safer.
And you have not even mentioned the variant, no? I mean, the fact that there are now 62 infected with the UK variant, that's a big factor. And there doesn't seem to be a definitive end to that yet, no? As a matter of fact, the sense is it's just starting, no?
Yes.
So it's really alarming.
Yes.
But okay, so the question is, I think what you've just confirmed is that it's more the economic cluster, siguro, within the IATF that basically pushed for the MGCQ, right? But
Right,
can
yes.
you, so can you give us a context as to how much it's going to cost us if we were to push through with the MGCQ in terms of healthcare once again?
Yeah, ang problem, no, if we really push for MGCQ and we're totally not prepared for it, no, yung Filipinos are not prepared for it, the transportation system is also not prepared, and also I'm not going to mention anymore yung contact tracing, no, which we seem to have already forgotten, and it's an important part of the preventive process, no. So eventually, we might actually be seeing an increase in the number, more increases in the number of cases of COVID-19, and with the, as you said, the 62 COVID variants that we have already recorded in the country, it is highly possible that the transmission of these variants is actually much faster than compared to the standard COVID-19 that we have had in the past. So, mas maraming tao ang magkakaroon ng COVID-19, and therefore, that can actually bring about more. No, we will be deluged again with so many patients, no, in the hospitals, and that again will also eventually redound on the economy. So instead of pushing forward the economy, it's even going to cause a breakdown in the economy again, because that means that we need to again put our Metro Manila into lockdown. So eventually, mas malaki ang effect niyan.